Thank you for clicking to complete the survey about supporting young children and their families. This community engagement project is a collaboration between various Minnesota state agencies and many community organizations statewide. The video should last about 6.5 minutes long. Please do take the time to watch it so you can better understand the survey questions that follow. Giving young children what they need to thrive should be simple, it should be effective, and it should be fair, no matter where you live, what your race is, or your income. In May of 2019, many organizations partnered with the state of Minnesota to gather community members and listen to their stories about what is needed to help young children grow and learn and be healthy and safe. In this video, we'll share what we heard about the challenges that people are facing across Minnesota. The first survey question here will ask you whether what you heard in this video represents your family's and your community's challenges and needs. And there will be a second video further into the survey in which we'll share what we heard about the solutions and action steps that we heard from communities. We engaged with 929 people across Minnesota, mostly in a focus group setting. Most people were parents themselves, and many were teachers or worked in childcare, public health, or are caseworkers or advocates. We met with people from many types of communities, from rural to urban, from southern Minnesota, Twin Cities metros, central and northern Minnesota. We also targeted many engagements to reach different racial and cultural communities, particularly Native American, African American, Somali, and Latino communities. Now, I'll share what we heard specifically about the challenges people are facing as they support their children ages 0 to 5, as well as the visions that communities hold. Challenges families face focus on access and availability of fundamental services, and that includes childcare, medical care, housing. The current support systems are just difficult to navigate, people say. They're confusing and insufficient. Community members describe a vision where everyone has access to needed services, community support, and connection. The system should be clear, accessible, and respond to their individual needs. And we heard people say that a fully functioning system should be holistic and address the interconnection of issues that connect families' lives. There is no one issue that could be fixed. All issues are interconnected. We heard across the state in many communities that racism, trauma, safety, belonging, and poverty were themes underlying many challenges. And while many community members may not have said those specific terms, they were a backdrop for many comments and conversations. Now, I will show you 9 specific challenges that communities across Minnesota said that they are facing. Childcare availability and affordability, financial and employment challenges, finding and accessing services, so that means navigating the system and applying for programs, healthcare availability, including dental and mental health, substance abuse and addiction, inadequate housing, lack of culturally appropriate services, quality schools and education. Racism is a problem across the state. Transportation. We also heard a big challenge regarding inequities. Specifically, families with any of these characteristics shown here experience inequities in the system. For example, low-income Minnesotans might sit on wait lists for a program that is meant to serve them. Another example is the opportunity gap between white students as compared to Native Americans and students of color. We also heard differences between rural and urban challenges, and the challenges in rural areas are largely location-based. So services are concentrated in urban areas or they're spread out across a geographic area, and that is exacerbated by a lack of transportation. A lack of childcare availability. Quality medical care is a challenge. In urban areas, participants focus more heavily on challenges related to equity, so racism and institutional barriers. And while urban communities might have more availability to nearby resources, we heard them talk about the same challenges in accessing those services. Now, I'll show you how community members described a vision of what a fully functioning system would look like or feel like. It would be affordable and accessible childcare. Parents would have choice, community connectedness, belonging, trust, and safety, education and support for parents on childhood development, parenting, and relationships, equal treatment across neighborhoods, schools, class, and race. Financial stability, fair employment practices, and job opportunities with better wages. Healthcare access, especially mental health, dental, addiction, and trauma. Holistic and equitable systems that respond to diversity of communities. Learning about culture and languages. Quality teaching in schools. Recreational activities for the whole family. Support in navigating the system. And transportation. And we heard people say also that the state should be active in creating a functional system. And I'll say a little bit more about that last point. We heard people say that the state has a responsibility to support their communities, especially financially. There's a sense that current restrictions, say for programs, just don't respond to real world costs and the reality of what families face day to day. So we heard people say the state should have better pay and benefits and training for early childhood teachers. Facilitate coordination between agencies. Funding is needed. Make it easier for families to access benefits and services. Make it easier to open a childcare. And the state should support availability of housing, childcare, and medical services. Thank you so much for watching the video. Now, please do answer that first survey question that relates to this video. And then after that question, you'll see another short video in which you'll get a chance to learn about the solutions that we heard from communities. Thanks again so much. Your insight does matter.